finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Hello, everybody, and welcome back again to BS Free MD, where we like to tackle the tough conversations that others won't. And today, we are diving into the murky waters of Big Pharma with someone who knows how to navigate the currents like no one else. And our guest is an investigative journalist who doesn't just uncover the story, she uncovers the truth. With over 30 years of experience at CBS News, PBS, and CNN, she's earned 5 Emmy Awards and the Edward R. Murrow Award for investigative reporting. She's been called fearless, relentless, and even a little bit dangerous to those who have something to hide. And she's not just a journalist, she's a truth seeker. She's flown in a B-52 in a combat mission, exposed corruption from Capitol Hill to corporate boardrooms, and tackled the biggest stories in medicine, politics, and beyond. And you might know her from her best-selling books, Stonewalled, The Smear, and Slanted, where she has exposed the layers of media manipulation and political spin. And now with her latest book, Follow the Science, How Big Pharma Misleads, Obscures, and Prevails, she's taking on one of the most powerful industries in the world. So I'm excited to welcome to the show Sharyl Attkisson. It's going to be amazing to have on a journalist who can help us decipher the spin in the media that's happening now, as well as what's going on in her latest book. So welcome to the show.
Thanks so much. I think we work flip sides of the same coin. You know, you're looking at things inside medicine and I'm inside journalism, and both of these things, the corruption and influences, cross over in a big way.
Yeah. So before we get really right straight into the book, I want to give our listeners like a little bit of background. So, you know, we were just talking before we started recording about how, as we've gone through our careers, us as well as you, they both used to be so different to what they are now. And so journalism, as people watch the news now, I mean, you can pretty much predict what's going to be on if you pick your news channel, because you know you're going to get the conservative bias on one or the more liberal bias on another, especially with them seeming to be laden with politics. And now their narratives, it doesn't seem to be just facts. Like when I took writing in school, the who, what, why, where, when, how, it's so opinionated. So tell us what you've seen change and sort of what's happened throughout your career, that your eyes were widened to.
I've written books on this, and I'll just try to summarize it by saying this has been a slippery slope of changes with a little bit of lurching in some key years in the early 2000s, when the pharmaceutical industry made a move in a big way to influence newsrooms and was successful in doing so because direct-to-consumer ads on TV became legal. Many people are too young to remember these were forbidden for most of my life. You couldn't advertise prescription drugs on TV. We're one of the few countries that allows this. But once that deal was struck, the media began compromising the stories that it reported. Before that time, it was very popular to start to look into these dangerous drug trends and the fraud and so on. All the journalism organizations were doing so. And then suddenly they didn't want to do it as much. And then we began self-censoring. And then there was another big turning point around 2015 with Trump entering the stage of politics. There were definitely organized narratives to try to portray him in a way that people wouldn't like him, even though he had been a very popular figure for decades, because he was uniquely dangerous to the establishment, Republicans and Democrats alike. He didn't rely on the same money sources. So they gathered together to create these narratives to try to controversialize him. And then again, during COVID, we lurched ahead in bad journalism by playing the role more than even ever before of censors and arbiters of information when we were actually furthering misinformation and suppressing the truth in a way that was harmful to the public health. So we've gone through so many changes. Not that journalism was ever perfect by any stretch, but it is a different animal today than most people who learned in journalism schools 20 years ago and plus would recognize.
So, just because we watching the news and, like I said, sort of comparing to what we know in medicine, how does it really happen? So someone who's a fresh grad comes out into the world and say they're working for a big organization and is it true that they think, oh, this is great, I have all these aspirations to just deliver the facts, and you get in there and they just say, you can't say that? Or just, it's like, well, this pharma company, will we all see, brought to you by Pfizer on everything, says, no, we can't say that? Or is it top down? Is it kind of in between? Is it very blunt like that? It's like, no, you can't report that.
Well, I think sometimes they're told you can't report that. Sometimes it's self-censoring because they come to understand pretty quickly, if you have to propose your story to some editorial authority, mm-hmm. and you say, I found a great story on this, and you find they're not interested or excited about it. They're not going to say usually, hey, that's a sponsor to our corporation. They're going to say, that's not very interesting, or why don't you do this story instead? But even before they come out into the professional world, journalism schools are now sometimes becoming skewed. They are being funded by these same billionaire authorities and foundations that want to skew information on other levels. They're funding schools and school resources. So the kids are being indoctrinated pretty early on, just like I think doctors come to be indoctrinated starting in medical school.
Oh, it's exactly what happens. Like I have vivid memories of getting free pizza and an educational, experience especially during internship and residency. I mean, free food when you're an intern, like that is like, that's nigh unto winning the lottery. And, they would tell you about their hair growth treatments or their blood pressure medications. And I mean, it happened. It was unbelievably pervasive. Like it was absolutely everywhere. And this is 30 years ago. I mean, we graduated medical school 32 years ago.
Did you have at the time, did you ever look at the Merck manual?
Yes.
Heck, absolutely. Yes. That was like one of the little Bibles we carried around.
It even has Bible paper in it.
So let me tell your audience a little bit about that in case they don't know. I had a pediatrician once call that the pediatric Bible. And I think Bible is an interesting word, not just for what it looks like, but the idea that it's not just a reference, it's a Bible. And people are shocked when I tell them that's published by Merck Pharmaceuticals. And it's considered today one of the most popular references for med students and doctors. And it's wholly written by Merck, although they claim their editorial arm is separated with a firewall from their pill-making arm. So I look through it to see what they're teaching young doctors about key issues and controversies. Are they telling doctors about their own controversies, about the controversial HPV vaccine Gardasil, the lawsuits, the side effects? And I found not only serious omissions, but blatantly false information. And the easiest one to cite quickly is they claim, when I looked online, that there are no serious side effects reported for the Merck Gardasil vaccine. But you need go no further than look at the label of the vaccine, which Merck also wrote, which is FDA approved, which lists dozens and dozens of serious adverse events reported, everything from paralysis to death. And yet doctors are being taught there are none, zero. It's outrageous. And I think it explains a lot as to why doctors are steered in a certain direction. And then as a patient, you go, unlike the two of you, but I would say your average doctor may not sound like they're even listening or even ask you if you had any potential illnesses or anything that could be an adverse event after you started taking a medicine.
Well, we saw that absolutely, like, right smack dab in our faces. So we were both working in urgent care, and I was working almost exclusively in a respiratory clinic. So basically a COVID clinic where we could separate, geographically patients so that, there was some distance between, the contagion. Like, that worked, but that's besides the point. So it would have been about March or April of 21, once the vaccine was rolled out to basically everybody, we just started seeing tons. Like, every single day you would see a vaccine side effect. And it was clearly a vaccine side effect. POTS syndrome in a 30-year-old. Like, they saw one of those, hadn't ever seen a case of that in 30 years of practice. You saw what, 2 or 3 myocarditis? In
one day, two myocarditis back to back.
And then Moderna arm, where you get the injection and you have a red arm for 2 or 3 weeks or months. to the point where it literally had its own name. And we would go to our colleagues and we'd say, this is clearly the vaccine. There's only one thing that's changed, is the vaccine. And they're having medical side effects clearly from this injection. Well, it can't be that. And I'm like, well, what do you mean it can't be that?
And this is like daily.
Like, what else is it? Is it the N95 mask? Is it walking the opposite direction in Safeway? I mean, there was only so many things that we changed that it could be, but it just couldn't be that.
That's what boggled our mind, was
and we were just
the
like,
colleagues.
Doesn't make any sense. That's when we got really red-pilled, because shortly after that, they said, okay, now we're going to give this to children. And I was like, whoa. Kids don't get COVID very often. They don't get very sick. They sure as heck don't die. And you're going to give them a gene therapy with no long, like they have potentially 90 years of side effects to accrue. And that's when we just completely pulled the pin. We said, there's something's up that we can't explain.
You open the door to one of the big flaws I address in the book. It's good for doctors like you to be monitoring, hey, this is obviously a side effect, and some action could be taken quickly if patterns emerge and are addressed. But doctors, the ones who deny that could be it, they're not supposed to make that decision. They're supposed to report to the adverse event database whether or not they think there's a reaction. It's not up to them to know. It's too early. They don't have the information to know if something that sounds like it could be unrelated is related to the medicine or vaccine. They were required, supposedly, to report these serious cases to this database so the federal government would have a look at raw data to show them if there were emerging patterns that were unexpected. But doctors were not and are not reporting. Doctors, to my knowledge, every time I ask someone who's sick and goes to the hospital, aren't even asking patients, did you have the shot? Or when was your last case of COVID? So they're absolutely not reporting to the database that they're supposed to be reporting to so that we can unearth these patterns. And as an establishment, the medical establishment is not encouraging this proper reporting, or it would be done. It's not hard to do. It may be a little bit time consuming, but it's actually not a difficult process. I've done it for, consumers can do it if their doctors don't, or if they're worried that their doctors aren't doing it. So it's not like brain surgery. So I would argue that they don't want to know. They don't want, meaning the establishment, these patterns to be examined and to see what might emerge.
You're right. No, I would, from our experience on the inside, it's exactly the truth. Filling out those various forms is no fun. It is time consuming, and depending on what your clinic is like, if you're in an ER or we're in an urgent care setting that's just busy, no regular patient rapport, I might not see this person again. It's onerous. But when we would ask other people about, have you ever filled that in? Did you ever, think that it might be related to the vaccine or a side effect of the COVID, or they wouldn't even consider that. So the fact that filling out a VAERS report, would just never happen because they wouldn't entertain the idea. And we've just, met other like-minded colleagues working in a similar system. They're like, yeah, gynecologists who are dealing with this uptick in number of miscarriages and abortions when a patient had the COVID shot 2 weeks before, they would go, oh, that's just not even possible. So why would I even want to report that in the database? Because it just can't happen, because
it's not effective. The instructions clearly state it's not up to them to decide. They don't have the knowledge or information.
Right. Exactly.
The raw data is supposed to go in there, and someone else will make that determination down the road. But I think you're right. Doctors will often say, I don't think this was what caused it, therefore. It's like, why are they not being told you don't make that decision? Like that's data that's supposed to be going into a database.
Right. Yes. And I think very much arrogance, because you don't get to decide.
It's the two. I mean, this sounds so terrible, and we diss on doctors a lot, but it's the two primary emotions in most physicians is fear and arrogance, which is a terrible combination. It can't possibly be that. I know that I'm a doctor. Well, actually, we've talked to lots of people that aren't doctors that have done exponentially more research on things like vaccines and know way more than virtually all doctors. This is just knowledge. You don't have, we have special experience because we see patients, but we can read the same journals now. It's not that hard. There's smart people in all sorts of different walks of life. And then there's this fear that you're going to be the outlier, that you're going to be the wacky anti-vaxxer or the wacky conspiracy theorist or whatever it is. And we finally got to the point where we just don't care what people call us. I mean, we've done tons of stuff on the, gender identity, and it's like, call me a transphobe, call me a whatever phobe. It doesn't like, you just have to get to the point where it doesn't matter. What matters is the truth.
Yes.
The reason is you have stood up and stood strong, and actually it depends on what career path you're willing to accept, but they can't hurt you beyond your career. And if you kind of invite the criticism and say, as I have, of course, that's what the propagandists would say about me and my views, because that's what they want you to think. If you call it for what it is and stand up, it's actually possible to survive it. But most people just don't have the stomach to go through what they think it would take to stand up and address, the misinformation and the propaganda. But the fact that you have to say, as so many people do before they raise a vaccine question, they have to say, I'm not anti-vaccine, but is the result of one of the best and most well-orchestrated propaganda campaigns of our time. That when you're asking a rational question about a medicine, you have to preface it by saying, right, I'm not anti-vaccine. Well, of course, you're probably not, just because you asked a question. And I liken that in my book to saying I uncovered Ford Tire and Firestone rollovers, but people didn't suggest you're anti-tire. You're doing all these stories on tires. I've done a lot of stories on other medicines, statins and so on, and no one accused me of being anti-medicine. Like, you must hate medicine. No, I'm asking safety questions. But suddenly they've created this environment where all vaccines, in their view, at least you're to believe, are grouped into some altruistic category where they have no side effects or no harm, where the benefits always outweigh any risks, which are minimal. And it's just not true. Obviously, vaccines have been pulled off the market for safety reasons. It's just, it depends on you and your body. It depends on the particular vaccine. You can't say vaccines are safe and effective. Which ones and for whom? But too often we've been taught with this jargon that has proven very effective from a propaganda standpoint, and they know that, to accept these generalities about vaccines and other things.
Well, I just was having a conversation with one of my friends last night, and it's just bizarre. Like, it's like as soon as the word vaccine comes into the conversation, it's like people are totally bewitched. Like we had where I work, in this area, there's been a little pop-up of pertussis, like a handful of cases, literally a handful, like 5 or 6. Okay, well, in adults, it's a treatable illness. It's a very easily treatable illness. And it's largely an inconvenience because you have a irritating cough for 3 weeks. Well, I suggested if we PCR tested absolutely everyone that came in with a quote cold, we would probably find tons of pertussis. The reason that we freak out about it is we start testing in clusters and then we find what's already there. Well, of course, the response I got was absolute silence because of course, like absolute silence, because of course it's out there, because the vaccine for pertussis isn't very good. It doesn't do something. Of course, should you vaccinate your kid against pertussis? Honestly, I don't know, but the fact is, to even mention the word, it's just like these blinders go on. It's like using saying Hitler or Nazi or any of these things. It's just like it just has this weird power.
That was invented by the industry around 2003. People didn't used to feel that way about vaccine questions and vaccines. 2002, 2003, when the autism epidemic was really becoming recognized, the industry understood it had to do something to get ahead of court claims and investigations looking into the possible vaccine relationships. So they came out with this campaign, which has been super effective. I like to tell one story. Would love to hear what you guys think about it. When I tell people why it's so important that we get full information on medicine and vaccines that we're not getting, when my daughter was fully vaccinated, because I hadn't done any of this reporting, years ago, and I didn't question doctors and studies and so on. When it came time for a polio vaccine, I remember the nurse saying, do you want sugar water or an injection? Because there's a choice of two vaccines, the oral polio vaccine and then the shot. And as a mom, you're like, oh, sugar water. Why would I give my daughter another shot if she can drink sugar water? Found out years later from one of my sources in federal vaccine court where vaccine injuries are heard. He said his most heartbreaking cases, and he's very pro-vaccine, but he's a realist because he's seen so many vaccine injuries. He said the worst cases are polio because the oral polio vaccine can give your child a small risk of getting polio. Mm-hmm. And the last cases that he had, and the last cases in this country, as you guys know, of polio were caused from the oral polio vaccine. And I felt so betrayed because my doctor didn't allow me informed consent. I got no printed material, no oral explanation that this is what they should have said. Do you want sugar water, which could give your daughter a slight chance of getting polio, or do you want the injectable version, which carries no risk of getting polio? I would never have given her the sugar water. So I think that's just a great story that exemplifies we're not getting full information. They're withholding the truth from us. And sometimes
it's to the point where they pulled the oral polio vaccine. It's not even
shortly after my daughter got it. But it's still being given in other countries. And I'm looking now in Gaza, they're giving polio. I don't know if you've seen the video to children because there was a case that was unearthed and they're squeezing the kids' faces and putting these drops or whatever in their mouths. And I'm thinking, I'll bet none of those parents are being told that carries a slight risk of giving their child polio. And that there's a version of polio vaccine that carries no risk. I'll bet they're not being told that.
The other side of that coin
probably comes with a lot of incentives to get their kids vaccinated, on the backside of the WHO,
but the other side of that coin is the oral polio vaccine is a better vaccine at preventing polio. And so it gets down into the numbers of if you really have an endemic polio area, you really actually want the oral polio vaccine. The difference is we have no polio, and the only polio that's been diagnosed in the United States in the last, 50 years was vaccine associated. So obviously that risk benefit is completely different than if you were in an area that had tons of polio, which right now is basically nowhere.
True.
So it there's a lot of nuance in this as well.
So let's get into what inspired you to report and focus on the pharmaceutical industry in your new book, Follow the Science.
Well, I've written a few other books. I'm not a medical reporter, but I've lucked upon breaking a lot of global medical stories, such as Viagra can cause blindness. I broke that global news and things like that, not because I'm so much smarter than any other medical reporter that is on the beat, but because maybe I'm outside of that profession and I don't just listen to things that are spewed out by my sources in government and automatically believe them without critical thinking. So it's not that hard to identify some things when you talk to independent doctors, maybe those outside the circle, the connection between Viagra and blindness, a connection between antiperspirants and breast cancer. These were discovered by scientists outside the profession where you think they would be discovered. It wasn't the urologist who detected this trend among men who were on erectile dysfunction drugs. It was an eye doctor who saw sort of a rare form of blindness appearing in a lot of patients and began asking questions and found they were all taking Viagra. In the case of the antiperspirants and breast cancer, it was a physician whose wife had died of breast cancer, and she had been a frequent shaver and antiperspirant user, and it led him down a road looking at other studies and conducting his own. So it's frequently not the insiders who are going to find those results. It's reporters on the outside, researchers maybe in a related profession who see the obvious, that for some reason, the ones who are being taught in continuing medical education classes by the industry, for example, not to look there, they're not discovering these things. So it's a long answer to say HarperCollins came to me, I've written other books for them, and said, let's do a COVID scandal book, investigative, some of what you've unearthed. But we agreed by the time the book came out, because this was a year and a half ago, some of that's been very well done. And I said, let's make it more global. Let's talk about the fourth pillar that results in us being sicker and sicker despite spending record amounts of money on insurance and healthcare and hospitals and pills. And that is not just the pharmaceutical complex, which we know about, influencing media, which we know about, influencing politicians and government, but the medical establishment, how that factors in. The studies are not to be believed in the medical journals. That's by the account of lead medical journal editors-in-chief themselves, such as Dr. Marcia Angel from the New England Journal of Medicine, formerly such as Dr. Richard Horton, formerly of the British journal Lancet. These are things that people don't know about happening on the inside that the medical establishment is involved in often invisible ways that impacting how we're treated or how we're not treated for the things that are wrong with us.
Well, and it's exactly right. I mean, I just kind of call it the bullshit grinder of money. So pharma makes a bunch of money, donates it to the politicians, also helps write the legislation, which then, the politicians through the NIH and all these other places write grants to all the universities. The universities then invest their massive multi-billion-dollar endowments back into the pharma industry, and around it goes. But then there's this festering sore of corruption in the media, though, because it used to be where, you had the fifth estate or the fourth estate, the media, this extra branch of government, so to speak, that was supposed to be there, like a herd dog biting the ankles of the cows and keeping everybody honest, being the guard dog as well as the herding dog. And then they just got bought off. I mean, the direct-to-consumer advertising isn't just dangerous because patients go in and talk to their oncologists about, what chemo agents. It's because they've bought the narrative. I mean, I think it's just completely, obvious now.
You're absolutely right. And I would say this is a story of disappointment in doctors who should know better and be standing up, but even from a greater degree, disappointment in my profession, journalists, who I think you described it perfectly. I thought we used to be sort of an equalizer, that if our politicians were corrupt or there were instances where the medical profession might not be doing the right thing, we were there to expose that and be another voice and make sure all viewpoints got out. We've now joined the club. We're part of the censorship. We're part of making sure that certain views, even when true, are not aired or are controversialized. And I couldn't be more disappointed that we've taken this turn toward darkness. And it's funny because that's how I think Dr. Marcia Angel described the turn of medical journals. She said, turn toward darkness. And I feel that way about the journalism profession too, when it comes to covering health matters.
So did you get any pushback or have any big obstacles or challenges from people on the inside when you were writing this or trying to look at things? Nope.
I mean, I have an independent TV show now called Full Measure, where there's very little to no interference, unlike CBS. And no, I'm sure people are not happy about the book, people in the industry, but it's so well sourced and put together. They're just going to have to hang their heads and agree and accept that the facts are the facts. And I'm sure they're hoping a lot of people won't read it. But I've tried not just to be, people are telling me they've read the beginning now because it came out yesterday and they're angry. And I knew that would be the reaction because I'm giving hard cases, data, and anecdotes that are going to just blow your mind. Even as much as you guys know, there's stuff in here I think that would shock you about behavior of scientists who've conducted unethical studies on babies and just horrible things. But definitely there's a huge part in the book that says toward the end, now you've been informed, there are things you can do. And I try to take people through critical thinking exercises that you guys use, that I use, to try to identify better sources, to try to figure out who might be more reliable than the people that are so often cited in media and on TV shows and in journals. How can you cut through this managed information landscape? There's ways to do that. And unfortunately, it takes a little work because the media is not doing that general filtering for you. But you can do this. And I think it ends very hopeful, giving people tools that they can start with today in taking back control of their health and understanding the system and how to change at least the course that it's taking for themselves.
I think that is an absolutely wonderful point. I think that I think we should be overwhelmingly positive and hopeful now. And the reason is this. I gave this example when I gave a speech a few weeks ago. I have a friend who's in his second marriage and he's super duper happy. Like, it's just wonderful. And, he finally, found this perfect woman and he's been married about 6 or 7 years now. The the day that changed everything in his life and allowed him to move and have this wonderful new relationship was the day he found out his first wife was cheating on him. And so we're at the stage now over the last couple of years where we realize we've been cheated on. And that's an awful, horrible feeling. So you have two choices. You can sit back and say, the world's corrupt. This is terrible. I'm going to get drunk and let it all burn down. Or you can say, no, now we see. Now we see, so now we can change. Now we see the corruption, so now we all have a choice to make on what direction we're going to go. And I think enough people's eyes have been opened. And there's so many resources like podcasts and your book and all of these things where finally people can go, okay, I get it now. And I think COVID was, as horrible as it was, a gift in some respects. And I think it's disrespectful to the people we lost in COVID to not understand that there's positives from that in opening people's eyes. And we need to leverage that as much as we can.
Well put. And we've come to some of the same conclusions, you and I, about this. I argue that because the censorship and control was so audacious during COVID, it was already happening. But it was so obvious and in your face during COVID, they didn't even bother to try to hide it. It opened a lot of eyes, and it made activists out of people who never considered themselves activists and may not have really been paying attention, who began asking critical thinking questions that they'd never thought about before. So that's great. Part two of that is there are a lot of doctors like you guys who were part of the medical establishment who have broken away from what we might call mainstream medicine, but are forming new groups and resources where they're trying to conduct studies that the medical establishment has ignored, trying to get at root causes of our chronic disorders, immune problems, metabolic problems, cancers, mental disorders, you name it, that are not being addressed well with studies funded by government/pharma. And they're forming new organizations and resources that are growing, where people will have new resources and new doctors to go to and more information than we've probably had in the past 20 years.
So I'm curious your thoughts on the influence of the pharmaceutical industry in so many aspects, from the news media into the medical schools and the, direct to consumer advertising. How do we know what sort of we think as physicians, how maybe things could be bettered? I'm curious what you think. Is there a way to reform what's happening in the farm industry? I mean, is it as simple as stopping direct-to-consumer advertising, stopping their influence on the media, or is it more than that?
It would take a lot. This ship needed to be turned, or the starting needed to happen many years ago, 20 years ago, and it didn't happen. So I don't think there's a simple answer. I don't think we'll see the end of direct-to-consumer advertising in this country, though I think that would be a positive step. I don't think we'll see news organizations at this stage do what I suggested over 15 years ago at CBS, establish a firm firewall between editorial and corporate, so that if advertisers call, as they did when I was doing stories on statin risks, if they call down to the news division and say, those stories are really bad for business, that the news people ought to be able to say, I'm not allowed to talk to you about that. There's a firewall. There should be, that's protection for them. But the corporations don't want to make that firewall. They've accepted the interference. So there are things that could be done. A lot of it would have to be done at the professional level. The medical associations, which have been more or less bought out, would have to have different standards when it comes to those who are allowed to sit on boards and make decisions, the government as well. Right now, the government basically says, yeah, we have all these conflicted people on advisory boards deciding things while they're being paid by the drug company that benefits, because everybody's being paid by a drug company. So how can we find someone who's not being paid by a drug company? So our answer is they just have to disclose it. Well, that really doesn't solve the problem. If everybody's, let's say, in my opinion, on the take to some degree, and they all just simply disclose who they're getting paid by, you're still getting conflicted information. You guys may know some years ago, nearly the entire board of experts that decided what to do about cholesterol, that our numbers should be lower and that we should be taking better steps like using these brand new statin drugs to lower your cholesterol. Well, all of them practically were being paid by statin companies and had not disclosed that. And when that was raised by a bunch of independent physicians who said the advice was all washed up and that the government should look at it independently, the government didn't. They just let them, after the fact, declare their conflicts of interest and went about their merry way. I mean, that's a story repeated over and over again, including during COVID, when I followed the money with hydroxychloroquine and why this treatment that was being investigated, rightly so, as a potential prophylactic preventive use for COVID as well as early treatment, why it got such a bad rap and the government wanted to make sure nobody was testing it or using it. Well, I think you have the answer if you follow the money to the board that was making recommendations for the government. And I found a good number of them were being paid or had recently been paid by the company making remdesivir, a more expensive, novel, untested drug that they wanted to market for COVID treatment. And it got all the favored decisions, while poor hydroxychloroquine and ivermectin, which are generic and cheap and have been on the market for decades, proven safe and effective for other things, while they got controversialized unfairly and unnecessarily, I think following the money absolutely tells the story when you look at the people making the recommendations.
Well, it's interesting because our friend Harvey Risch, the Yale epidemiologist, I always tease him that he's got an atomic powered brain. He's just, I almost have to take Ritalin to listen to him because he's so smart. And he was like, the hydroxychloroquine studies really early in COVID is what actually red pilled him, because he looks at it as an epidemiologist and he goes, these are just nonsense. Like they're not treating patients at the correct time, for the correct amount of time, for the right dose.
Oh, yes. I mean, that was, I think, intentional. The studies that they were putting out to try to make it sound negative, they were putting out at a time period that they knew that even those who thought hydroxychloroquine worked didn't work and wouldn't work late in the stages of the disease. And then when the FDA put restrictions on hydroxychloroquine, they said at some point, this can be used only very late in the game in the hospital, which meant when someone is very, very sick and about to die, which nobody thought hydroxychloroquine worked at that stage. It's something that has to be, the research had shown to date, given early if it was going to work or have any kind of effect. So here the government is forcing that if it's used at all, and if you do a study on its effectiveness, it will look like it doesn't work or it's even killing people, because you're being forced to give it only to people who are so sick that it will not benefit them. So there's all these little tricks, I think, that were going on with that and with the ivermectin as independent researchers were trying to, ferret out whether we had an answer already on the table that could have changed the course of the pandemic.
Well, they just took Pierre Corey and Paul Merrick's board certification away like 2 or 3 weeks ago. Because they're these crazy misinformers. I mean, these guys were legends in respiratory medicine before COVID. And then they had the guts to actually experiment and try repurposed drugs. And then they got, they got nailed to the cross. I mean, it's just, it's the trickery. I mean, this idea with giving people in the hospital an antiviral, even remdesivir, is so completely insane and against all common sense. Anyone who's treated anybody with Tamiflu knows you really want to give it not within the first 48 hours, within the first, 24 hours. That's how antivirals work. We all know that, but somehow it was just like out of people's heads. Someone comes in with a respiratory virus needing to be intubated and they get an antiviral agent in the hospital. How did that happen?
Well, there is a chapter, there are mentions in my book about Dr. Corey and other doctors, and I wanted people to understand, as they've been controversialized, how esteemed, as you said, some of these physicians were considered to be in their field until the moment that they differed with the establishment on COVID treatments. So I asked the question, were all these doctors who went through medical school and were well published in many cases and at the top of their field, were they crazy all along, but you just didn't know they were crazy till COVID came? Or is it more likely that these doctors had reasonable and rational courses of action that they were taking, and you just decided as the medical establishment you didn't want to hear this, so you controversialized them rather than, accept or listen to their perfectly rational lines of inquiry?
Well, that's the perfect question, and Peter McCullough is like another person, one of the most published cardiologists. And when he started and was well respected until he started to question it and then became blackballed. And, that's in medicine. What we talk about in the history of medicine is what's always progressed. It is asking questions. It's science. So you're supposed to question everything and you set up a hypothesis. And, just from knowing 7th grade science classes where you're like, okay, this is my question. Let's test it. And you might get surprised at the outcome. But now we can't even say, well, maybe we should look at this. It's like, absolutely not. It's been shut down. And that totally just squishes what the whole definition of science and medicine has been built upon. And just like journalism, if you can't even search for the facts and present them without an opinion, I mean, it just has upended everything you knew about your profession. And so
a lot of similarities.
Exactly.
Well, that's the thing. Aren't both careers supposed to be the pursuit of the truth? Yet now we have these orthodoxies that you can't go against. And it always reminds me of Ignaz Semmelweis, who in the mid 1800s said, it's probably a really good idea after you do an autopsy to wash your hands before you deliver a baby. Like that might be a good idea. And, they threw him in an insane asylum and beat him to death. And so medical orthodoxy and going against medical orthodoxy is not a new thing. Yet, just 40 or so years after he was killed, germ theory arrives. Now, all of a sudden, we're sterilizing surgical instruments and Lister and all the other stuff that came with it. And so, the point is that if science is going to progress, it's going to progress only with dissent and debate. That's the nature of it.
Well, remember the fact that I think people think the goal of pharmaceutical industry and our healthcare system is to make us well. And actually, that's stated nowhere in the description of what a pharmaceutical company does. In fact, it could be argued that the way our system is structured, they simply have a fiduciary duty to shareholders or whoever's making money off the pharmaceutical company to do what's financially in the best interest of the company, not what's in the best interest of you and me. And if that means they know a medicine might not work very well or might do harm and they can cover it up, some would argue they have a fiduciary duty to do just that because their top goal is making profit. It's not getting us well. And I think people forget or somehow put drug companies and government sort of in a different category and think that they have these altruistic motives and missions that they don't necessarily have. And it's a hard truth when you do think that your whole life, as I did, and then you come around to facing reality and going, oh, that's right. There's nothing in their corporate papers that says they're supposed to make us well, give us the best medicine.
No, they're a business, just like McDonald's or Dairy Queen has no interest in getting you the best food necessarily. They just they have a product and they want to make money. So
when I was firmly entrenched in corporate medicine about 20 years ago, I actually did a little bit of speaking for Lilly and went to one of their conferences, a sales conference. And I'm just sitting there, and maybe it was the Holy Spirit. I'm listening to these guys talking about expanding markets for psychotropic agents. And I was like, I kind of feel dirty. Like there's something about this that's just, it's kind of like you're watching a naughty movie and your dad walks down the stairs and walks into the living room all of a sudden, and you're like, I feel really uncomfortable. And I mean, it was really bizarre to hear people with an absolutely straight face that aren't medical talk about a pharmaceutical agent and patients as just a market to be exploited for a certain product. And I'm like, yeah, but your product is an antipsychotic agent and you're trying to expand the market. So you're literally trying to get more people on antipsychotic agents that just so happen to cause metabolic disasters and give people type 2 diabetes. Doesn't matter. We just need that market to explode. It's wild.
Well, interesting that at least you knew and had the critical thinking skills to think about the obvious, the financial relationship between the speaker and what he was saying. Today, doctors go to continuing medical education classes and they listen to people who introduce themselves by their academic or professional titles, but do not disclose that they're there as paid representatives for a product or a pharmaceutical company. And the doctors who should know better swallow the data and what's being told without questioning that maybe there's a potential conflict of interest there. An acquaintance of mine told me this amazing news that he had heard about some vaccine that I knew was controversial and problematic. And he said there were no side effects. This is great stuff. And I said, whoever's telling you this works for the company. And he said, no, I don't think so. No, he's this, academic. An hour later, this person called me back and said, you're right. How did you know? I said, all the speakers, they work for the companies, or they're getting some financial compensation. And the example I use in the book is I wanted to see what doctors were being taught. Left-leaning Medscape had some material up there for continuing medical education course on COVID vaccine safety in children. We now have the benefit of hindsight. We know kids shouldn't generally be getting the vaccine. And I wondered what doctors were being taught. And I found, first of all, there were 3 guys, actually a woman and 2 guys, introduced again by their academic and professional titles. And nowhere did they mention they work for an A to V list of vaccine makers and pharmaceutical industry. One guy, I think, had 12 to 14 under his title. If you looked in the right place in the fine print on the slides that linked on the website, but this is not in the discussion. So the doctors eating up all this information, which omitted facts about the adverse events from the vaccine on children, omitted the case of poor Maddie DeGarry, the 12-year-old who was probably the first child injured by a COVID vaccine in Pfizer's COVID vaccine trial. That doctor's study never even acknowledged her side effect, very serious one, and should be a red flag in a small study. And then now doctors are being taught by another conflicted doctor at this seminar that there were no serious adverse events to even be acknowledged. So, the whole system seems tainted, and it's no wonder that our doctors walk away without real good, well-rounded information on these products they're being sold on.
Yep.
No,
well,
I mean,
we knew actually, we listened to pharmaceutical talk or medication talks years ago. And I don't know, most everybody that came in, we just knew that they had an association with the drug company. They were paying them to represent, and they were the expert though, because, they could look at all the data through their unbiased clinician's eye. And now, my eyes, even though I knew that they might be funded by pharma, I'm like, well, they respect the profession of medicine and they want our patient's best interest at heart. So they'll discern whether it's going to, because I trusted that more than I trusted the financial incentive. And I've come to have my eyes, opened.
Well, and they're quite literally forbidden researchers who unearth negative things about a medicine or maybe hired by a company at an academic institution to do a study. As you guys may know, the contracts are so buttoned down now, unlike 20 years ago. They can't talk about if a study comes out negative. They're not allowed to publish it. So you may not know that 19 out of 20 studies done on a medicine were bad. And they'll publish one that maybe looks slightly good and they'll play that up. And the patient will never know there's 19 things that said this does really bad stuff, because they've controlled the terms under which the researchers they hire can make the information public. So
it's good. Just a big scandalous thing.
And that's, that's exactly it. Like, I was absolutely stunned. Again, I had to practice medicine for almost 30 years before I realized that when something goes to, quotes, peer review, they don't get the raw data. They get the study that's published by the sponsor. In other words, the drug company. The pharma company gives the study, then they peer review that. They don't go and get all the raw data that the peer reviewer can then crunch on their own and make their own determinations. That's not how peer review works. And I was like, you're kidding. So, we interviewed Sharyl Attkisson a couple of years ago, and she was telling us about, the raw data in the 43,000 people in the Pfizer trial. It's like 90,000 pages. And so they literally were building AI algorithms to go through the data and call out all the side effects that weren't reported. And she was like, there was no quality controls. There was really no safety monitoring in the actual study because they just excluded those people like Maddie.
Yeah.
Well, let me address a couple more things about studies. I've currently got 2 challenges going. Well, one just ended a couple days ago. With multiple corrections added to a peer-reviewed published study that I challenged, again, over a year ago. This is how long it took for them to correct it. I've had other studies corrected, and medical journals. If I, as a layperson, can look at this propaganda, in my view, and see flaws and mistakes and misrepresentations that peer reviewers aren't catching, I think this is intentional. And when I've tried to look at who the peer reviewers are, they say, I file Freedom of Information Act requests because these are federally funded studies. They say you're not allowed to see that. You're not allowed to see the peer reviewers. When I tried to get the communications to see, did the government assign this study, as I suspect, as a piece of propaganda to counter something that was happening in the real world that they didn't want people to believe, such as they didn't want people to think the Amish experience with COVID was positive when it was. So they put out a study that wrongly culls through data and misrepresents the findings to make it look like they had a bad experience. I want to find out what were the communications between the government and the grant recipients. Well, you're not allowed to see that. We redact that. When I want to find out why a Columbia study that was funded by our taxpayer money makes ridiculous conclusions about neurology events after COVID vaccine and why they culled the data the way they did, I'm not allowed to see that because Columbia is a private university and they're not going to release the data, even though that nullifies the study in terms of scientific method when they won't share data and you can't replicate it. So I think the government's found a way to use our tax money to legally launder it through private institutions or colleges or whatnot in a way that we can't see whose hands and fingerprints were on bad information and bad data to put out propaganda that most people won't question. They'll just quote it. So, I found out earlier this week that the Amish study had, I think, 4 major corrections added. I'm not satisfied with, they're still kind of misleading. They left the misleading title on it, but I'm glad that the researchers at least were forced to make these embarrassing corrections. At least that's a small
that's great.
And thanks, to you for stepping in. As a journalist, it's almost, let's say, embarrassing that other physicians aren't trying to correct this, but that you can fight for this, for what is right in the publication, and try to make small steps in a massive pile of garbage that's out there that's really affecting, how we take care of people.
I mentioned in the book, people can do this. If you get interested in a topic, an unethical study on premature babies that the government was funding at major academic institutions such as Yale and so on around the country that violated tenets of informed consent, according to the government's own ethics body. That was unearthed not by any insiders. That was unearthed by a dad who was not involved in the study, but read some results and said, what were they doing to these babies, withholding the proper oxygen treatment from their premature babies, some of which died as a result, according to the observers who went through the study. That was just a dad who was interested and looked through there and exposed this whole scandal, which, by the way, has sort of been covered up, but at least it got some exposure. Last point I'll make, since I brought up the baby oxygen study, which is in the book, recently the government exempted itself from having to give informed consent to people in studies. So the informed consent was bad enough to begin with, and they've now decided, and something that's been little discussed, but I'll be reporting on in my TV show Full Measure, that if they decide the risks are minimal, they don't have to tell you, because they don't want to scare you away. They think people aren't taking part in studies when they know the full facts. And I'm thinking, well, if the risks are truly minimal, then why are you scared to tell people what they are? And regardless, first of all, you've been wrong in the past. And secondly, that's not your decision to make. No. The people in studies get to decide what risks they're told about or what they want to be told and what they choose to act on and not act upon. This is a huge change in rules that were in place since the unethical Tuskegee syphilis experiments have now been lifted without really much discussion at all. I think this is shocking.
Well, it's against Nuremberg too.
Yeah.
Nuremberg was, you have to give informed consent, period, for any kind of experimental anything. So, it's just, I'll sum up the pharma talk here with, if Big Pharma really worked the way the advertisers say, and the food pyramid worked the way everyone else says, and the cereal aisle worked the way the Monday, the Saturday morning cartoons say, then we'd all live to 105. We'd have 6-pack abs. We'd be super happy, unbelievably smart, with perfect sexual function. And unfortunately, we're fatter, dumber, and sadder. So
Yeah, that's
clearly
a
something.
wonderful way to put it. I that couldn't be more true.
So
if we could for just a couple minutes, I know May's itching to ask you some other questions.
No, you don't know. I was going to say, looking ahead, there's what we've done. We found a platform. We've got shut down a few times on certain ones because we say the wrong word or have certain people on, but Rumble has us. So where do you see journalism going other than mainstream media now? It's kind of like medicine. There's a resurgence of clinicians who are going out on their own and starting direct to consumer.
Direct patient
care. Thank you. Direct primary care. So you see media starting to change in that way as well.
Good question. That's Substack. That's these new things that are coming up. And I don't think that's the end. We're never going to go back to what we had. Not that it was perfect, but it might have been better than what we have today. We're not going back to that. And I don't think we're where we're going to end up, but I think we're starting to see new models that people are trying to develop where people who tell the truth and put facts out that are off narrative can't be canceled and can't have their payment systems taken off the shelf so that they can speak freely about what they're learning or even opinions that are off the narrative. People are looking for ways to do that and finding them. It's a more diffused sense of information. People are less likely to sit down and obviously watch a half hour of the evening news anymore. They're hunting and pecking on the internet and through podcasts. Not a bad thing. It takes a little more work, and it's certainly not a perfect system. But I think we're evolving to something that I hope will be better than what we've seen the past 15 years or so, this horrible information landscape that's developed.
Well, I think the more decentralized you get anything, the freer it becomes. And I think
you're probably right. Yeah.
That's a good thing. So there's one question I was really, just about your career in general. Was there one story that you got onto and you started researching it and you knew that it was a pretty much bulletproof story and you were like, I can't believe this is true? Was there anything
Absolutely. I would say a lot of them. Benghazi, the cover-up over Benghazi, Fast and Furious, the government running weapons to Mexican drug cartels. How can that be true? The vaccine autism links that I always thought sounded crazy. And then I looked at the studies and found good sources in government. The joke in my household is that I would come home from work after speaking with whistleblowers and doing research and tell my husband, some story like the government's running guns to Mexican drug cartels. And he would his funny line was, I hope you're going to check that out more before you report it, because it always sounds so unlikely. And the thing it's taught me is the most unlikely sounding things can be true. So there are things that I listen to, and probably most of what tips I've gotten over the years either aren't true or don't rise to the level of national reporting. But enough of them do that I try to listen to a lot of them. And even the ones that sound ridiculous, I sometimes go down a rabbit hole to see if there might be something to them. And sometimes there is.
So that must have, with the length and breadth of your career, that must have bought you a fair bit of political capital, I would think. Like, people know that if they're going to come to Sharyl Attkisson, they're actually not going to get dissed if they're a whistleblower. Is that a fair thing?
That's what made, at full measure, I can air these stories freely now on my Sunday TV show. But why I left CBS mid-contract, those last few years, I actually won several Emmys and did a lot of great stories the last couple of years, but more did not air than aired. And it was painful to almost be able to easily report so much because whistleblowers would come to me, and I was pretty good at, knock on wood, never been, proven to have been fooled by a whistleblower. Mm-hmm. A lot of them don't end up being in stories or having things worthy of a story. But the ones that did seemed to have a national story that I could check out, proved factual and true. But I would have people come to me with amazing stories and risk their careers because once they decide to step up, they're like, well, the CBS Evening News at least is going to expose this. And I never made promises. Nothing ever turns out good for the whistleblower. So when they would say, what's going to happen to me? I would say, you can't expect you're going to keep your job. No one's going to hold you up to be a hero. But what you're saying will be a resource that will endure online and people will be able to find this information and understand that it's true. Well, those people I would end up having to call and go, I know you risked your career and did the interview with me and your bosses found out, but no one's going to air the story. I mean, that was so painful got to be a regular thing. And I would tell my husband, I can't do this. He said, why can't you just go to work and finish out your contract and do nothing? I said, I can't do it. I'm on to some of the best stories of my career, and they're not seeing the light of day. It's dishonest.
Well, it's interesting because, maybe someday we'll come to the other side of the state and go out for drinks and we can tell each other's stories, because I'm telling you, May and I talked so much about this of building a coalition of the like-minded. And it's fascinating when we meet people like yourself. It's like, it's the same animal spirit that animates this. It's
I know. Yes.
It's the, and I think it's God, but that's another discussion. But I mean, it really is this same spirit, because it's these people that we meet from just like we interviewed an anesthesiologist, and the courage he had to stand up for what he believed in. And I'm like, holy moly. And these people just started popping up. It's like COVID has been this heat that's popped this popcorn of courage in some people. And I love it. It's so awesome.
I agree with you. One of my last big stories a couple years before I left CBS was the Fast and Furious story. And the guy that helped break it open, I'm not sure a sitting federal agent had ever done an on-camera interview like this before, but he did for CBS Evening News. He exposed what they were doing. The government was denying the gun running, and he was taking part in it. And he went on camera and said, you tell me now. He said, I've done this every day since I've worked here. You tell me now to my face that I haven't been doing it. And when he talked about what happened to him and how they treated him, this was at a time at CBS, I'm thinking, he's telling my story. Inside journalism, I'm also suffering this sort of, don't say that, don't do that, look the other way. And I started to realize our stories and yours, inside the medical profession, there are similarities. It's kind of happening to everybody. There are politicians trying to do the right thing on Capitol Hill and hold hearings on important matters that are being told the same thing. We can't do that. Look the other way. Quit causing trouble. I mean, this is endemic, and yeah, when we run into each other, our stories, I think they feel a lot alike.
Yep, because they are.
Absolutely.
I could ask you a fun question here. If you could interview any historical figure, who would it be? You ever thought about that?
I've heard someone else be asked that. I don't have a great I'm somebody who would tell you I'd have to think about it. I'd have to put some serious thought into it. I don't know.
That's okay. I know. Sometimes I get asked those too, and I'm like, it's so vast. There's so many great people.
So we don't leave everybody hanging. If you were a journalist and you could talk to somebody from the past, who would you like to interview?
Oh, that's a good one.
I've heard people.
I know exactly who. I know. I mean, there's the whole. Well, it would be Jesus or whatever, but I don't think that's fair. I think that you got to take Jesus off the table. No, for me, it would be a biblical figure. I think it would be David. That whole dichotomy of being such an unbelievably great leader from the time you were a teenager to being so unbelievably corrupted by your power. I find that so fascinating. I do not understand that, but that is the story of human leadership as long as there's been humans.
Okay, I thought of one. George Orwell, because if you look back at his quotes, he foresaw today. I mean, it's shocking how accurate his portrayal of what could and would happen was and what's come to be. Would love to actually hear his reflections on what's become of us, but also just to talk to him more about what he foresaw and foretold with his work, because that would be pretty fun.
Yeah, that would be really fun.
Yeah,
it is those. I've always said that in the spirit of creatives is where you really start to get a real nugget of truth. I mean, even Tom Clancy would do lectures at Quantico for the agents, because you have to imagine, you have to have this imagination for how the other side is going to think. Mm-hmm. And so it's and Huxley, if you take those two books, we're living in the Brave New World, Animal Farm 1984 blender.
Yeah.
People are willingly giving up their rights for convenience or drugs or whatever.
The fact they're even talking about that censorship is good and people shouldn't be able to hear what the government would decide is misinformation. I'm bowled over, that these conversations are happening.
Well, Robert Wright came out in the last couple of days and said that, Elon Musk should be arrested and Twitter should be taken down.
Oh my gosh.
And I think Kamala Harris said that, X should be taken down. It's just, I hope people, wake up and speak up. Don't be silent.
Yeah, no, that's
I want you to share one last time where people can get your book, as well as where they can watch you on your program on a regular basis.
Thank you. Order the book on Amazon or buy it at your local bookstore. That's good for the sales thing.
Mm-hmm.
Follow the science. And fullmeasure.news. After the TV show airs, we feed to 43 million viewers every Sunday on different TV stations. But if you don't have one in your area, or you want to look at it anytime, like right now, you can go to fullmeasure.news online and watch it. There's also a station list there. And I try to cross-post most of what I do, not just on my Substack, but at SharylAttkisson.com. So you'll be able to find my stuff if you search.
Wonderful. And we can link that as well in our show notes and online for everybody. So happy to do that. Well, we have been so honored to have you come on and talk with us and share a little bit about the book and the inside of journalism, and there's so many parallels in medicine and what's been happening on the journalistic side as well. And people see that. But thanks again for taking the time. We really appreciate it.
I'm pleased to join you. Thank you so much for having me.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
Well, we try to keep BS Free MD as raw and real as possible. We can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.